Okay, let me just set the video up here, and hopefully we can see everything in this video. All right, good evening. My name is Tina Nordine, and I am the nurse practitioner student that's going to be doing Nathan's musculoskeletal exam today, assessment. I have walked in the room and introduced myself to Nathan, and Nathan walked in the room and sat down, and he came to the clinic today with his mother, who is also me, who consents to this video recording. Nathan is 14 years old, and he has agreed to do this, to consent to the video. So Nathan, I'm going to be doing a musculoskeletal assessment. That means looking at your skeleton and your bones and your muscles and everything. Nothing's going to hurt, and wanted to let you know that this video will be shared on YouTube. It's going to be untitled, and I'll be sharing that with my professor so that she would be able to grade me on how well I do a musculoskeletal assessment. Okay? So do you agree and to consent? Say yes or no.
Yes.
Okay, so Nathan, part of the musculoskeletal assessment, I did say I washed my hands, right? So I washed my hands. So part of the musculoskeletal assessment is looking at different parts of your body. The first thing is to inspect your hands and your wrists. Okay, so we're looking at your hands, and what I'm looking for, I'm going to look bilaterally at every body part, meaning bilaterally means I'm going to look on your left and your right, okay? And when I'm looking at your hands, I'm looking for swelling, deformity, any redness. I'm looking for any what's called atrophy, muscular atrophy. That means that our muscles aren't growing or moving. I'm looking for any nodules. And Nathan, I'm looking for symmetry in your hands. So when I look at your hands, I see that they are symmetrical, meaning that they're about the same. I don't see any deformities or swelling, and I don't see any redness in your hands, okay? So the next step is called palpation. And Nathan, what that means is I'm looking at, I'm palpating your hands and your fingers. And when I'm doing that bilaterally, I'm looking for any tenderness, redness, any pain. Do you have any pain or swelling or tenderness in your hands? So I'm palpating that. I'm palpating to see if there's any masses or any nodules or anything like that. That's out of the ordinary. So Nathan, everything looks good in your hands and your fingers. The next thing is called range of motion, and part of that is abducting and flexing and extending a wrist. So I'm going to ask you to, up and down, putting your wrist up and down at 90 degrees, so you're able to do that. And then do your fingers out like this, and then bringing them in towards you. That means adding adduction, and then bringing them out, abduction. So away, adduction, okay? So in and out. So we're checking your fingers and your hands for range of motion in your wrist, okay? And then I'm also palpating what's called the metacarpals and carpals of your bones of your wrist, and we've done that. And then I'm also looking at the ulnar and radius, is where this is, so your wrist comes in, the bones, your ulnar, your radius, and your ulnar bones come in right here. And I'm just checking that to make sure that there's no, and I'm doing it bilaterally, coming in, your radius bone and your ulnar bone coming into your wrist, and we check that as well. So there's no deviation in that, and like I said, we checked the abduction and adduction through flexion and extension of your wrist. Okay, one of the things that we like to do is, a lot of people, especially that type a lot or write a lot, they get what's called carpal tunnel syndrome. I don't know if you remember that our Papa Nordine had carpal tunnel surgery done, because he would lose the feelings in his fingers. Down into his fingers, he'd lose the sensation there. So there's a test, it's called the Tennell's test, and what you do is you take the wrist and you would kind of tap, and I could use my hammer, or tap right here at your wrist, and if there's any pain in that area, that's the Tennell sign, and that would show sign of carpal tunnel syndrome. So Nathan, I don't think that you've been writing enough to have carpal tunnel syndrome, but if you did have pain in that area, that would be a sign of carpal tunnel, and we would send you a referral over to neurosurgery.
There's got to be a different way to get that, because I would write too much.
You write too much. Okay, so another test, I like it to call it the prayer test. So you can do like this, and we would ask you to hold that for 30 seconds. And while doing that, when you're pressing in, when you let go, if after 30 seconds, that test is also called the Phelan's test. It's what I call the prayer test. And then we can also call it the reverse prayer test if you did like go down. Either way, so you would hold that for 30 seconds, and when you let go, so you can, let's say it's been 30 seconds, if you let go, there would be pain in there or swelling or tingling in your fingers. That Phelan's test would be an indicative of maybe carpal tunnel syndrome or another neurological syndrome in your nerves of your hands and your wrists. Okay, so Nathan, we looked at your hands and we looked at your wrists, and then we want to make sure that we say, when we did inspect your hands or your wrists, we're looking for swelling, redness, deformities, and that's with any of the body parts. When I'm inspecting, the next area I'm inspecting is your elbows, and I'm going to look bilaterally, meaning I'm going to look at both of your elbows as well, and I'm going to just even look at the back of your elbow, looking for any swelling or deformity again, Nathan, and any type of joint non-symmetry. So it looks like your joints are similar, and I don't feel any nodules or warmth, or I don't feel any nodules or any abnormalities, and I do feel that they are symmetrical. So Nathan, the part of the elbow exam also is looking at any type of pain back here. We're palpating for any pain. That little bone that's right back there on the back of your elbow is the olecranon process. That's a big word, but that right there, that tip of your elbow, we call that the funny bone whenever it gets hit. But when the funny bone or the olecranon process, we want to make sure that also is intact and it's not in pain or anything like that. And then the lateral and medial epicondyles, I look on either side, both bilaterally. So I look on either side of your elbow to see if that bone, you feel that bone right there? Mm-hmm. So if those bones are in pain or if they are symmetrical on either side, and they do look like they are symmetrical on either side, Nathan. So in that area, I know you're a golfer and you also play baseball. And that's where a lot of people have what's called baseball elbow or golfer's elbow, or also tennis elbow is seen in those areas. And you can get those inflamed, and also you can get some infection in those areas. So we want to make sure that when we're evaluating people's elbows, look on both sides and then see if they're symmetrical on either side. I know you're a right-handed pitcher, and it does not look like that elbow is any different than your left elbow, but we want to make sure that we keep an eye on that. Okay? And then Nathan, part of the next step is, just like we did your wrists and your hands, we look at what's called range of motion. And Nathan, part of range of motion is extending. Yep. So extending your arms out, and then also with your elbows, we want to flex them, or extend and flex your arms. Okay, and then put them out. Put your palms up, and then we're going to have them supinated and pronated, down, up and down, up and down. And it does not look like you have any problems with doing that either way: flexion, extension, supine, or pronating of your elbows. So very good. So next area, Nathan, is the shoulders, and part of that, again, I want to inspect them. So I always inspect first before we go to the next step. I'm looking for any swelling, any deformities, I'm looking for symmetry in your shoulders. If your shoulder were like I know you've had a friend that had a shoulder dislocated, that shoulder would be lower than the other shoulder, but yours are symmetrical because you've never had your shoulder dislocated, thank goodness. I'm looking for any atrophy, like I was telling you earlier, nodules, symmetry, deformity, redness, etc. I'm also palpating. So the next step after inspection is palpating. And when I say I palpate, I'm touching or feeling to see if you have any tenderness or any fluid. A lot of people have fluid in their shoulders and that causes pain. Nathan, it looks like based on looking at your shoulders, you're not having any pain, any fluid. Are you having pain in your shoulders? No, okay. And then the next part is kind of palpating, or I'm going to use the pads of my fingers along, here's the supraclavicular notch, and then I'm going to palpate along your clavicle up to the this bony process in your shoulder, and that's called the acromion process, that little pointy little part of your shoulder that sticks up, and that kind of reaches down from your scapula around the back. But the acromion process, and where they meet, is called the acromioclavicular process, and I'm checking that. And then just below the acromioclavicular process is what's called the coracoid process, and that's just here, and I'm just feeling around there. And then I'm going to feel around for your humerus, and then your supradeltoid bursa, which is that area. So your deltoid muscle, and then feeling in the bursa area. And then coming along the side, would feel, say, where your bicep meets up to the bones here, your bicep groove. And of course I will do that bilaterally on either side. And then make sure that I'm feeling, again, palpating for any tenderness or swelling or any nodules, deformities, or etc. And then, so Nathan, part of our next step would be range of motion, and that would be flexing and extending, so in your shoulders. So if you can move your, let's see, if you can move your arms back like this, you would bring them straight back. That's called a scapular motion. And then bring them forward. And I'm looking at how your shoulder does with that. And then Nathan, actually I am going to ask you to stand on this one. If you can put your arms to the side, on your sides. And then, let's see, I'm going to turn you to the video. So arms at the side, and then abduct your arms and adduct. So first we're going to bring our arms out to the side like this, and then bring them in back in. And then if you can bring your arm across your chest this way, and then if you can do the other arm, all like this, okay? And then can you put your, very good, you put your hands back to your side. And then can you put your hands up and touch, scratch, like scratching the back of your head. There you go. Yep, there you go, scratch the back of your head. And then the other thing is, can you, like mom does, I'll stand with my hands on my hips. Can you, yep, there you go. Put your hands on the small of your back. Very good. Okay. So Nathan, I'm going to ask you to have a seat one quick more second. I'm going to, all right, good job. Okay. All right, next, and then just put your palms out like this. And then don't let me push down. And I'm going to be looking at your scapula area and see if you've got any pain in your bicep area or anything in this shoulder area, okay? So don't let me push down. All right, very good. Very good. Okay, so that's one of the special tests that we would do to check for your shoulder as well. So that's just another way to just kind of check for everything that's going on in your shoulder area. So the next thing, so we've done, the next thing we would do is your head and your neck assessment. Again, I'm inspecting your head, your neck. I'm looking to see if there's any abnormalities. Looks like your posture is upright and you're sitting up well. And then I'm going to check, you ever heard of TMJ, temporal mandibular joint? Have you ever heard me say I kind of grind my teeth? I know Dad is grinding his teeth. So what I'm going to do is I'm going to feel for your temporal mandibular joint. Kind of move your jaw a little bit, up and down. There you go. Very good. Okay, looks good. Very good. So that part, looking at range of motion, does that hurt?
Kinda.
It hurts a little bit? Okay, we'll check you out then. All right, and then I'm going to look for any tenderness there. And then if you can, what's called... let me see, make sure. All right, then I'm going to make sure that when I'm looking at any muscles in your neck and your head, and then down along the front, the cervical around the back, cervical muscles, around your head. Okay, then we have to do, just like we did our arms and our fingers and everything, we have to do flexion and extension. So can you put your chin to your chest? Very good. And then can you put your neck back, head back? Very good. And then can you put this left ear to, your right ear to your right shoulder? And then can you put the left shoulder? That's right. Very good. All right. Back up. And then can you open and close your mouth? And then okay, very good. And then put 3 fingers like this. And then laterally, so up and down. If you could open your mouth. Very good. You put 3 fingers in there. Very good. Okay, very good. All right. And then can you move your jaw side to side like this? There you go. Good job. All right. And then another test that we would do is kind of what's called the Sperling's. It's the cervical compression test. I'll push down. Are you feeling any pain in your neck area or back here? Back in that neck area in your cervical compression. That kind of, we have our C1 back here, a cervical vertebrae. C1, 2, 3, 4, 5. Back in this way area, if we push down on your head, we can compress that and see if there's any pain there. Okay? So we've done kind of the top part of your body. Now we're going to go from your bottom part a little bit up. So I'm going to do your feet, your toes, and then your ankles, and then your knees. Okay? So we're going to work our way up. So Nathan, I hope that the video sees this down here. There you go. Okay, so the first thing I'm going to do, of course, is inspect your toes and your feet. And what I'm looking for are any calluses or any bruisings or any swelling. I'm going to kind of sit here too, because Mom's been on her feet all day. So I'm going to look for deformities, any corns, any nodules, Nathan, any plantar warts. You used to have a plantar wart, didn't you? Way back in the day.
Maybe.
A bunion.
Wait, can that only be on the feet?
They can be on your hands too, or plantar, only feet, but you can have a wart on your hand. All right, and then flat feet. So when you're standing, do you have flat feet? And I hope the video understands that I did have him standing a minute ago. So he does not have flat feet, and he does not have any bunions or any corns or anything, except he does need his toenails clipped. All right, and then Nathan, we're going to palpate the digits, and I'm going to palpate on the bottom of your feet. So, you know, Dad has plantar fasciitis down here, and that's where it hurts. So, you feeling any pain in that area? No. No? In fact, you would.
But I do after I walk.
A lot. Okay, so feeling, palpating your digits, and making sure that I don't feel any nodules or deformities or anything like that, Nathan. I'm going to ask you if you can curl your toes. So, and then flex your toes up. And then your ankles, can you go up, down, yep. And just kind of round and round and round. There you go. All right, good job. So, I did hear that. All right, so can you turn your feet in? Like, there you go. All right, turn your feet in. And can you, and go out. Okay, good job. And then we did do, pull your toes up towards your nose and push down. Okay, good job. Okay, so I'm going to look at your ankles next. Again, looking for any swelling around your ankles, any deformities, any redness, any, we want to look for discoloration of your ankles, and I don't see any of that. So the other thing is I'm going to palpate next. I'm going to kind of feel for the medial and lateral malleosis. So those are those bony little points that are on your ankles. And I want to do that bilaterally as well. So those look to be symmetrical and even on either side. And then I'm looking what this little bony part on the back of your ankle right here. Do you know what that is? We've talked about it before.
The back ankle.
Yeah, the back ankle. It's the Achilles. So we want to check the Achilles, and any nodules or any tenderness, okay? So after we've palpated your ankles, your toes, and your ankle area, your feet area, we want to do range of motion. So can you rotate your ankles in a circle? All the way in a circle. And can you flex? And there you go. Dorsiflex, huh?
Nothing.
Okay, very good. Okay, so the next area would be looking at your knees. And when I look at your knees, I'm looking again for any swelling, any nodules. I'm looking for redness, alignment, vagus or varus deformities, and I don't see any of that kind of thing. So I'm going to also palpate. I'm going to palpate both knees, again, looking to make sure that they are symmetrical in that. And I'm looking at the suprapatella pouch. So here's your patella. That's your kneecap. And then underneath that is that little area. Sometimes people have oshkosh, I forget what it's called, but your friend Nolan has that deformity of the kneecap where it's really painful. But you look in that area. And then I'm going to go to the, look at your patella and the sides of the patella, and then on each side. And then back in the back is called the popliteal fossa. So I'm feeling the back of your knees to make sure that your popliteal fossa is good. And I'm looking for what's called the Baker's cyst. Okay, so Nathan, I'm going to ask that you bend your knees for me and then extend them out. And then that's called the straight leg test. And Nathan, that, if you can flex your knees up to 120, yep, both sides, and then straighten them back out again for range of motion, okay? Now, the next thing, can you come up here and lay down? And then let me have your legs, okay? So, you know how Mom had to have her meniscus repaired?
Mm-hmm.
And in order to check on a meniscus tear, and again, I'm going to do this bilaterally, we have to do a couple of tests that are called the valgus and the varus stress test. And this tests for any meniscus damage that you might have. So what I'm going to do is I will hold the inside of your knee and press the outside of your ankle like this. And if you have any type of pain right here, you'll let me know, okay? So we'll do that. And then I'm going to do the opposite, vice versa. So we have the valgus and the varus test. And then I'm going to press on this knee and push with this ankle. And if you have pain on the inside, that would be the interior meniscus. And then I would do that the same on the other side. So this ankle, the outside ankle, and the inside knee, pressure, and then vice versa. And that would check to see if you had any meniscus tears, Nathan. So another test is called the Lachman's test, and what I have to do with that is I would have to sit here on the bed with you, bend your leg a little, and sit on this foot. And Nathan, I'd pull a little bit behind your popliteal fossa and see if your tibia and fibula, if I pull towards me and I'm trying to move your tibia and fibula, and that is not moving. So that would be a negative on that test. And then this foot, same thing, kind of sit on the bed, the exam table, pull your tibia and fibula, and see if there's any like pain in that area. So, and I don't see any of that. So there's lots of knee tests, Nathan, that we have to do. Let's see, the next area is your hips. And so part of the test will be done in the bed and part of the test will be done standing up. But what I'm looking again for your hips, and also in a normal exam you would not have clothing on, but I'm not going to ask you to take your clothing off. Okay, so in this exam I'm looking at your hips. I'm looking for swelling, nodules, deformities, any misalignment. It looks like your hips are aligned. I don't see any type of any issues there. So I'm also palpating the iliac crest, and I'm palpating along both hips areas, and then I would do that also to get the posterior iliac area. Now, why don't you turn over onto your belly for just a second, and then in order to check that, I would also check the posterior iliac spine area, and I do not feel any malformations of your sacral iliac joint or posterior iliac spine. All right, so head back up, turn back over there. You go, buddy. All right, good job. And then flexion and extension of the hips. So Nathan, I'm going to ask that you bend your knees up, and I see that you can bend your hips, and then put your legs straight back out, okay? And then when I had you turned over, I could have actually turned back over. I got you going back and forth, okay? Can you lift this leg up? There you go. And I'm looking at this hip. And can you lift this leg up? And I'm looking at that hip. Okay, good job. All right. And since you're young and active, I'll have you turn back over this way. Actually, just on your side right there. And can you bring this knee up to your, okay, not that knee, the other knee. This knee up and back. And up and back. Okay, good job. And then turn towards me on this side. Good job. And then bring this knee up towards me and back. And I'm looking at your hip. Looks good. Okay, and you can be on your back again. All right, so flexion of your hips, abduction of your hips, extension of your hips. Extension, flexion, abduction, abduction. Okay, so then, so remember I told you I needed you to stand up for the final part of the exam?
Yeah.
So this is the spinal exam, Nathan. And part of that is standing, looking at, let me see, I want to make sure that the video camera, hope, can see you. All right, so I'm looking at the back of your spine, and we have a natural curvature at the cervical and a lumbar lordosis or concaveness, and then dorsal kyphosis. So it's a natural kind of an S shape on our spine. I'm looking at your shoulders to make sure that they're symmetrical, and your iliac crest and your hips again are symmetrical as well. And then if you had no clothing on, again, I would look for any creases that were, I'm sorry, I didn't mean to tickle it, but there's creases on your buttocks that we want to make sure that those are symmetrical as well, okay? And then if you were to bend forward just slightly at 35 degrees, okay, I want to make sure that there's a symmetrical movement in your back. Just move a little, bend a little bit more. And there, when you're bending, I'm noticing that your shoulders, okay, bend again. Bend at the same time, and your hips are, they're not abnormal, or they're actually at the same height. That would show me that you have a normal spine in the back as well, and there's no scoliosis. There's a smooth curvature of your back. And if you can bend 90 degrees, can you bend, you know what 90 degrees is? Okay, so there you go. So I'm looking for scoliosis of your back. I'm looking for a normal smoothness of your vertebrae. And I'm palpating any spinal processes, intervertebral spaces here. And then I can also percuss with my fist along your spinal cord, and you're bending. Okay, then back. And then can you bend to the right? And can you bend to the left? And then can you twist like you do at social dance? Can you twist right and left? All right, very good. And then I'm going to ask you for the very final thing. If you'll lay it back down in your bed, and then that way you could, all right, back on your back. All right, good job. And then this is the actual final thing, part of our assessment. I'm going to ask you to do what's called straight leg raises. And with that, if you have any back, there you go, good job. And the other leg. Very good, because we always got to do everything bilaterally. And then Nathan, this becomes part of our, the end of our exam and our assessment, and I thank you for your time, and now you can go to sleep. Okay?
Cool.
Thank you. See you later.